Hey everyone, welcome back to this YouTube channel. Today we'll be diving into artificial intelligence, how it's revolutionizing healthcare, from helping doctors save time to predicting when AI may take over certain tasks. We've got a lot to talk about in this video and I haven't been the most active on this platform, so forgive me for that. This will be pulling from various sources like StartUs Insights and StartUs and analyzing the latest trends in April 2025. I will be talking about which roles it will benefit, which roles it may impact, and when we may see artificial intelligence actually fully integrated in a hospital setup. So the first thing that I would actually like to talk about is how artificial intelligence helps doctors. Because we live in a world where a hospital is all about efficiency. Imagine a doctor and many residents actually being bogged down with paperwork, billing, health records, discharges, insurances, all of that stuff. So this is where artificial intelligence is actually swooping in, automating that and making their schedules free so that they can actually focus on a patient. A review article in 2025 said that tools like ChatGPT are already streamlining workflows and MRI analysis can actually be cut down by 75%. That's huge, right, for fast diagnosis, especially in emergencies. Plus, AI is generating reports for specialists using labs, images, sound data. It's saving hours, it's cutting costs, and it's tackling doctor burnout, which is a big deal. Health Tech magazine, which is a very famous magazine, highlighted new tricks like ambient listening, think less note taking, and machine vision for proactive care. It's preventing falls, it's not replacing doctors, it's making their lives easier. Now, which doctors are actually loving artificial intelligence? It's the most data heavy specialties. Radiologists, they have to look like a bunch of paperwork, analyze x-rays, analyze MRIs. StartUs Insights in 2025 spotlighted heavy AI, which helps spot strokes in brain scans really fast. Oncologists are next, using artificial intelligence for early cancer detection and biopsies. Primary care doctors also get a boost with artificial intelligence, triaging patients, managing chronic diseases like diabetes. Cardiologists and respiratory specialties are also in on this trend, with tools like MetaPlus predicting heart and lung issues, in people who have a lot of risk factors, because these fields do thrive on data and artificial intelligence, a trick up their sleeve for faster, more accurate decisions. The United States, India, and UK are leading this charge as per StartUs Insights in 2025. Now, which doctors might artificial intelligence actually impact? This is like a burning question amongst all of the people in the medical field. Will it actually replace doctors? Not fully, but it may cut down shortages, by actually aiding a doctor. Like it may help in assessments like reading scans, instead of rather passing it to a human for the final call. Now, radiology is a prime target. Radiologists might see less demand as AI tools like Dectrocell screen test x-rays. Pathology is another one with AI analyzing slides. However, Forbes in 2024 said AI is more about redefining roles and not axing them, because empathy and judgment, right? Humans are still like top class for empathy and judgment. Now, people think artificial intelligence could replace doctors eventually, but most see it as just a helper, starting with like boring stuff like medical coding. So rural and data-driven roles might feel it first, but I don't think, it's replacing actual human judgment, empathy, and human emotions in the near future. Now, when will artificial intelligence actually fully take over? We're already on a fast track. Innovator's 2025 report says 90% of hospitals will use AI for diagnosis and remote monitoring this year itself. That's huge. So that is insane, the amount of money, the amount of manpower going into all of this. However, there is a catch. Privacy biases and costs could slow this down. The World Economic Forum says we need strategy, not just speed. Add in regulations like the HT1 rule from Health Tech magazine and full integration, where AI standard in most hospitals looks like, 2035. Maybe that's when we can actually expect the whole integration into the admin system as well as the patient treating system, as well as actually making the lives of residents and interns really easy. So there you have it. AI is transforming healthcare. It is helping doctors save time. It is helping patients get their data faster. And people are kind of hoping for a full integration by 2035. And remember, it's a team up between the doctors and the artificial intelligence and not a takeover. Do drop your thoughts below and please hit that like button if you enjoyed the video and comment and subscribe for more. See you next time.